So that leads us on to the next segment here. Our very own Sara Chokshi, Director of Research at HITLAB, is going to be interviewing a graduate of the Breakthrough Alliance at HITLAB, Amir Reuveny, the CEO of Wesper. So I'm going to hand over to you, Sara, and looking forward to this segment.
Perfect. Thanks, Jerry. Hi, everyone. Hi, Amir. Nice to see you. I'm here today to talk with you, Amir, CEO of Wesper. Before we dive in to hear a little bit about your experience with Breakthrough, can you tell us all a little bit just about your personal background and your journey to becoming CEO of Wesper?
Sure. Very happy to be here, and thanks so much for the invite. So I'm originally from Israel. Grew up in Israel. Then I studied a double major degree in electrical engineering and physics. Graduated with honors in 2005, and then joined 8200, which is an elite intelligence unit in Israel, where I developed different software and hardware for intelligence purposes. Great organization, very mission driven. One of the best experiences that I had working with different users and also the brightest minds in Israel. Following that, I went to get my PhD in flexible and ultra flexible electronics in Japan, in Tokyo University. This is where I specialized in the thinnest, the lightest sensors that exist. We made great breakthroughs developing technologies to acquire signals from the human body, from the brain, in a very, very soft and flexible form factor, published in Nature Nanotechnology, Advanced Materials. So really a prolific time in Japan. Later, I wanted to really combine my two passions, one in healthcare, the other in building things for good, and build something in healthcare. And I joined Cornell Tech University as a postdoc to the Runway program. This is where I basically started Wesper.
You mentioned the Runway program at Cornell Tech. And I think that may be something the audience here would be interested in hearing a little bit about, both the program itself and your experience there.
Yeah, sure. The Runway is that, yeah, sorry?
It's quite unique, so.
Yeah, it's actually a very unique program. They serve a very specific audience, which are PhDs with leadership experience that want to build their own companies. And they provide a lot of resources to help people make this transition from the academia to the real world and to the business world. So I have a very vast network of mentors and advisors that can help you in building this, in building your own business. I spent about 2.5 years there. They give you some initial funding and training how to become a CEO and how to lead an organization. Specifically in healthcare, I think it's very, very important because building innovation in healthcare is very challenging, as you all know. It required the attention and the adoption from many different stakeholders, the payers, providers, patients, and the Running Pro actually gave us the time to make this transition properly and do all the research that involved and the clinical studies. So this was a really amazing time there.
Fantastic. You mentioned having a passion for healthcare. Where does that come from?
That's a good question. I never deeply thought about it, but I think it's maybe my passion to help the society and the world that I'm living at. I think in any time of my life, I was always trying to build things to help other people. If this guard our national security in 8200, then build in the academia, build tools for better healthcare capabilities and currently. So I think that's something that comes with me for a long time now.
Great. Um, Good to know. So that's been for a long time, but not so long ago. I know you were part of HITLAB's Breakthrough Alliance challenge, and we're very successful. So we'd love to hear. We always love to hear from our alumni. So just maybe our audience would like to hear a little bit just about your experience both in the program and what impact it's had on you thus far.
Sure. We are super excited to to become a HITLAB member. At the time, I remember applying to the program, and once we got in, we were really excited. And I think that the best thing we got out of the program is really the skill and the confidence in conducting clinical studies. As a very young company, we just I think we were admitted just like maybe 2 months after we established back then it was Thatch, and now it's Wesper. So we were admitted into the program. So we actually did our first clinical study very early on with the HITLAB team, phenomenal team that we work. It was kind of a turnkey solution to conduct a clinical study, which is very difficult to do. So we conducted, they help us identifying a sleep lab to work with, to recruit, if I remember correctly, about 15 patients in a sleep lab. And we actually tried and validated the technology, the comfort, the app with the team on 15 patients. This was, a great experience. Another thing that I can say, it was in a very specific time. So they had a very clear plan. We need to finish it within 6 months. After 3 months, we already started enrolling a patient and writing the, 2 months later, already writing the final report. So very professional, very efficient way to do this. And we talk a lot from this, except from the specific data we got from conducting the study. We now learn how to go through an IRB, how to write a protocol, how to work with patients, how to keep all the ethics that involve. Since then, we actually conducted 4 additional clinical studies in different in different sites. We work with the biggest hospital, Weill Cornell, Einstein Medical, Northwell Health, and others. So. And I think the experience with HITLAB really started started this journey for us. So really grateful for that.
Great to hear. So we were a little bit of research training for your team, which teach I guess they say teach a woman to fish. And so exciting that you've gone on to do so much more research since then. So important.
Yeah.
Can you tell us maybe 1 or 2 things that you learned from that study that were unexpected?
Unexpected. I think it was very early stages of the development, and we were really surprised to hear from people how comfortable the solution was, and how how they didn't feel it during the night, and they didn't, even though it was much clunkier than today. I have one example today. It's like very easy and light solution, but back then it was much more clunky. But even that, people really perceived it as a nice solution. So that was one thing. The other thing, it was a long time ago.
No, that's okay, and that's great to hear. A lot of times it's the UX piece that people are surprised to hear doesn't work out well for users. So
right.
It's great that.
And we put a lot of emphasis on the user experience, the customer experience, both in our physical product, but also in the app itself. And it taught us a lot, moving forward. Also towards like this FDA submission, we submitted to the FDA based on the clinical data that we collected. So.
Fantastic. So can you tell us a little bit about that? Like in terms of, it sounds like you've come a long way in a short period of time. Where are you all now? The milestones that you've met more recently, and sort of where you're looking to go next.
Yeah, sure. So our mission at Wesper is to really make sleep health accessible to everyone. There are a lot of bottlenecks and red tape in sleep medicine today. It's really difficult to get diagnosed, understand what you have, and then also continue with the therapy. The current medical route is really inefficient and expensive and inaccessible. They're just, as a fun fact, the ratio between sleep labs and people in the US is about 1 to 60,000. So you get like long waiting lists, a very expensive process. So we try to bring the clinical data to people through the platform that we built. And again, this is the patch that can collect all the information that the professional needs in order to understand if you have any breathing issues, if you have any positional dependency with your breathing, etc. So we are moving into two main trajectories. One is developing our marketing capabilities and user experience direct to consumer. So we have a great user experience and app that we've developed. So this is going really, really well. We launched the first version of the product back this summer, basically in July. Already serving customers, helping them improve their sleep. We actually saw that people could improve their sleep in a very short period of time. People that suffer for many, many years couldn't find the right solution for them, but thanks to our evaluation and the support that we gave them, within like 2 to 3 weeks, they're already sleeping better, which is really amazing to see. The second piece is really getting the clinical validation and also the regulatory pathway. So we've submitted to the FDA last year in November. Great. And now we're in the process with them. We're actually now completing our, I said like the fourth clinical studies, multi-site study in New Jersey, New York, and Missouri. So really collecting more information about the platform. We're going to conclude this study very, very soon and then resubmit our application. So hopefully we can get FDA clearance in the next couple of months.
That's fantastic. Great to hear. Congratulations. So we have 1 more minute. I have one question from the group. So just quickly, one of our attendees is asking, what were the biggest challenges that you experienced transitioning from a research background into a commercial venture?
There are many. To pick one is really, when you are in academia, you really think about the technology and how to innovate and how to build things like faster things. But when you come to the real world, the important thing is really understanding the market. I think this is like super, super important. Many people neglect this. So we did a very thorough market research before diving into this. And the second piece is really the product experience and the user experience. And sometimes very, very simple things can create a lot of impact. So this is something that we learned during this time.
Awesome. Great. Thank you so much, Amir. It was wonderful speaking with you.
It was a pleasure, Sara. Thank you.
And good luck. We'll look forward to hearing for good things from Wesper in the future.
Appreciate it. Thank you so much for the opportunity.
Wonderful. Thank you, Amir. Thanks for popping on. Really, really great to connect with you after coming through the Breakthrough Alliance. Just before we go on to the next segment, Sara, I don't know if you have any news from the Breakthrough Alliance at HITLAB in terms of any activity going on there in the near future that you can maybe share with the audience.
Yeah, stay tuned. We will be reaching out in the next, I'd say, month or 6 weeks, I believe, about the next challenge. So innovators, get ready. We're looking forward to working with a new batch of breakthrough companies.
Wonderful. Thank you, Sara. Thank you for coming on. Great chat with Amir. And please do check out the Breakthrough Alliance in the link in the chat box if you're interested.